Alright, so come in, we've assessed our scene safety, got our appropriate PPE on, which is just our gloves, and we're going to introduce ourselves to the patient and gain consent. Hello, my name is Josh from the Ambulance Service. What's your name?
Cody.
Cody. Alright, Cody, today we're just going to do a neurological assessment. And that's just going to involve just following a few commands and a bit of touching. Is that alright?
Yep.
Alright, so we've done our AVPU. The patient is alert. He can follow commands pretty easily at the moment, so we'll jump in and we'll do our FAST exam. So our FAST for F for face, we're looking for any abnormalities in the facial muscles, any drooping. The A is for arms, so we're going to make sure that we've got equal strength in the arms. S for the speech, we're going to say something and make sure you can repeat it. And the T is for time. Alright, Katie, so can you just give us a big smile, mate? Show us some teeth. That's good. Alright, so at the moment we're just looking for any drooping on the side. If there was any drooping, we'll just ask any family members or close friends if that was normal or not. The patient has passed his facial exam. What I should do is squeeze both my fingers for us, mate. Alright, excellent. So we're just looking to make sure we've got equal strength in both arms, which the patient has done so. Next up, we'll just lift your arms just out in front for us. Alright, now just close your eyes for us. Alright, so the patient can lift both, you put your arms down. The patient can lift both arms equally. He can close his eyes and keep his arms together, so that's a good sign. The S, we'll just say a quick sentence. Can you just say the sky is blue in Cincinnati?
The sky is blue in Cincinnati.
Excellent. So the patient can speak properly without any slurred words. If there was any slurring, we'll just ask any family or close friends again if that was normal or abnormal. And the T for timing is not applicable at the moment. We'll go through our AEIOU tips with the patient. A for alcohol, E for epilepsy, I for infection, O for overdose, underdose, U for urea, T for trauma, mainly we'll be looking for any head injuries or toxins, I for insulin, P for psychosis or poisons, and the S is for the stroke. After going through all that with our patient, we'll go through our blood sugar level, which is just going to involve a little prick on the finger. We'll draw a bit of blood out. Make sure the patient knows it's going to be a bit of a prick before we stab him. And then we're just going to take a bit of a reading. Make sure our readings are right in between 4 and 8 millimoles, which this patient is presenting with normal. We'll go through our GCS. So it comes in 3 stages: the I's, the verbal, and the commands. The patient is responding quite normally, so we'll give him his eyes movements a 4. If the patient was only responding to verbal, we'll give him 3. If the patient was only responding to pain, we'll give him a 2. If the patient's eyes wouldn't respond at all, we'd give him a 1. Going to the verbal, Cody, can you just tell us the date and today?
24th of the 5th, 2019.
And what's today it is?
Sunday.
Excellent. So the patient is quite coherent. If the patient was confused, he would be getting a 4. If the patient was giving me inappropriate words, he'd get a 3. If the patient was just giving me some sounds like moans and groans, he'd get a 2. And the patient wasn't able to give me anything, he'd be scored a 1. The following commands: the patient lifted his arms, he can follow the command, so he'd get a 6 for that. If the patient responded to localised pain, so if he was getting an IV in the arm, and he pushed my hand away from putting the IV in, he'd get a 5. If the patient withdrew from the pains, so like if we were putting an IV in, he pulled his whole arm away, he'd get a 4. If the patient was flexing, so if you gave him a trap squeeze, he pulled his arms to his chest, he'd be getting a 3. If the patient extended for the pain, so if you gave him a sternum rub and his arms went outwards, the patient would get a 2, and the patient couldn't follow commands, he'd get a 1. So that's our GCS done. We'll just do a pupil, have a look at your pupils, alright? So what we're just going to do is just shine a bit of a light in your eyes. Is going to be alright?
Yep.
So you're going to start on the lateral, we're going to work medial. So we'll just put the light into the middle, just looking forward for us, mate. We'll come around to the other side, go into the middle, and come up again. So your pupils are both equal and reactive, and they're sitting around about 2.5 mils, which is in the normal ranges. After doing all that, we'll then discuss our findings with the patient and decide on a transport.